A very good afternoon, everyone. At the outset, I thank Royal Global University, the nursing wing specifically, for inviting me to this auspicious occasion. Actually, we oncologists, for us, the World Cancer Day is something very, we believe that it is something like, it's a very important day for all of us. And not only for us, actually World Cancer Day is important for everyone around the world. Why? Because World Cancer Day, we have the motto of promoting awareness amongst the mass, because awareness is the only tool by which we can win over the dreaded disease called cancer. Now, while saying dreaded disease, I mean to say it is dreaded because it is detected late. When it is detected, it is already late. There is a taboo that cancer has no answer. But the fact is that cancer is not that dangerous, and cancer has answer. And if we have to have the answer, we have to know it, we have to identify it in an early stage. So that is where we need to know the disease. We need to know the cancer. We need to understand cancer. And apart from this awareness, we have seen that many people, they do not go to the physician or the healthcare facilities to get cancer treatment at early stage, either because they are afraid or because they don't have the facility by their nearby. Because it is a distant, like, there are many questions arise, like what is the cost of going to a hospital and what is the cost of treatment. So this year's theme, that is closing the gap, we want to close that big gap. Gap in knowledge, gap in attitude, and gap in practice. So for that, the main tool that is necessary is awareness. And being nursing professionals, we have to have a very deep knowledge about cancer. At least we have to have that much of idea. And I know that you have already that much of idea. But today, I'm going to just refresh your knowledge, or let us discuss something. If you have something to ask, please don't hesitate to ask. Now, for closing the gap, the main theme is prevention and early detection of common cancers. Now, let us at the beginning understand what is cancer. We all know the universe. The universe exists because of the fact that it follows the rule sthiti striti vinasanai. That is, what is created has to stay and has to be destroyed. Otherwise, there will be calamities. So, as it is srishti sthiti vinasanai, that is, whatever is created, it stays, it is maintained in a very nice way it is maintained, and ultimately it has to be destroyed. So every cell of human body is like an universe. Our cells obey the law of the universe, that is srishti sthiti vinasanai. So if this rule is disobeyed by these cells, then cancer occurs. If the cells grow out of control, then cancer occurs. So actually we are moving around with lots of universe inside us or in our body, because each cell is like a universe, maintaining the universal law. Now, approximately it is seen that 39.5% of men and women will be diagnosed with cancer at some point during their lifetime. So it is around 40%. So this is not a joke. 40% of men and women are going to be diagnosed with cancer. So is it not something scary? Is it not a nightmare? this is a nightmare. Like if we cross 3 people, the 4th person will have cancer. And that is happening in reality. When I joined BBCI, I thought, 20 years back, I thought that the OPD will just be a little, the patient load cannot be so high, because in GMCH, OPD is always it's full of patients. But I have seen that BBCI, people are coming as if they are having fever or some other ailment. So large numbers of people are coming from all around Northeast that it is, we don't have, it's very difficult to tackle. So that difficult the program is becoming now. Around 80% of the cancer cases, they come at a very late stage. And that is why actually it's very difficult to handle them. And that's why this is our moral duty to make the people aware so that they come at the early stage and we can treat them properly. These delays are primary delay, secondary delay, and tertiary delay. Primary delay is the major contributor. And primary delay is the delay because of the patient himself or herself. They come at a very late stage because either they don't know or they're very reluctant to come. So there is late diagnosis. Secondary delay is from coming to doctor and late diagnosis, and tertiary delays are there due to treatment delays and all. So these are some common cancers in men and women. In men, the most common cancer is lip and oral cavity, lung, stomach, colorectum, and pharynx. And in female, that is woman, this is, I think this is wrongly written as man. This is man and this is women. Actually, WO is, I don't know, it is removed somehow. So this is breast, cervix, colorectum, ovary, lip, and oral cavity. The top 5 cancers in men and women, it accounts almost 47.2% of all the cancers. And most of these cancers can be prevented. That is the main, this is tragedy. It's a tragedy because we can prevent it, but still we are not preventing it. Because the people don't know, they don't know that how to prevent it or how to control it. They don't like to go through simple screening tests. So these are the causes why they are detected so late. Now, I'd definitely like to mention here that the most preventable cause of death is tobacco. And most dangerous risk factor of cancer is tobacco. 50% of all cancers in males and 25% of all cancers in female are tobacco related. And in our OPD, we have seen that 60% of all the cancers coming to us are tobacco related. 90% of oral cancers are tobacco related. And when we go to the list of tobacco related cancers, the list is ever increasing. This is the long list going from the lip, you can see the list goes up to cervical cancer. So top to bottom, everywhere cancer can occur. And this tobacco comes in different forms. It may be chewable tobacco, it may be smokable tobacco. Even Mizoram, they use the drink as taibur. So whatever is possible, we try to take tobacco. And I hope in Royal Global University, is it a tobacco-free university? That is a very nice thing, because if it is a tobacco-free university, then really, really, you have done a great job. There should be a big applause to the university, because the proud of Royal Global if it is a tobacco-free, because I have been personally struggling with tobacco for last 20 years. And many universities I have seen, it is very difficult to control tobacco. And we can see young people coming with cancer of mouth. In our screening clinic, every day we get lots of leukoplakia, erythroplakia. That is the potentially malignant lesions of the oral cavity. So these are common cancers. To close the gap, we have to know the gap. So these are the gaps where we are failing. Head and neck cancer, breast cancer, and cervical cancer. There are so many hopes. Hope is large, but gap is low. That is the gap. Gap means knowledge, attitude, and practice is very low, whereas hope is very high. But we are not going, or we don't have that proper gap. And that is the gap. Now, let us go to oral cancer. What is oral cancer? We know that this is the most common cancer in India amongst the male and 5th most common among female. Why should the female lag behind? Of course, we compete with male in every field. So now in oral cancer also we are competing with them. So oral cancer. And do you know that India has been named as the hub of oral cancer? Just imagine, hub of oral cancer. What a medal we have. So this is very pathetic. This is very pathetic, and every day lots of people are dying due to oral cavity cancer, where we know that potentially malignant lesions of the oral cavity occur decade ago, almost more than a decade ago, before oral cancer develops. These potentially malignant lesions are very easily identifiable. These are called white patches or leukoplakia, erythroplakia or red patches, or submucosal fibrosis. So, and breast cancer is the most common cancer in female in India. Actually, previously we knew that cervical cancer is the most common, but in many parts of India now, due to rapid urbanization, changes in food habit and lifestyle, breast cancer is becoming more common. Cervical cancer is the 2nd most common. And to mention here, it is not that breast cancer occur only in females. Do you think, students, do you think that breast cancer can occur only in females? How many think that? Raise your hands. Raise your hands. So, breast cancer can occur in female as well as in male, right? So, though the percentage of females suffering from breast cancer is much higher than in comparison to males. If 99 female will suffer from breast cancer, only 1 male will suffer from breast cancer, but that is deadly. In case of male, tissue is very less, so it spreads very rapidly. Now coming to the oral cancer, we can see this is the oral cavity. So oral cavity consists all these things: hard palate, soft palate, uvula, posterior pillar, tonsil, tongue, posterior pharyngeal wall, anterior pillar, all these. Now, what are the risk factors of oral cancer? Tobacco, as usual, is the king of death. So this is the main cause. Then alcohol use, chronic trauma, poor nutrition, human papilloma virus infection, immune system suppression, age. With increasing age, we have seen that oral cancer increases. And gender, of course. In males, we can see that more oral cancer cases are upcoming, maybe due to their habit, because more males, they are using tobacco. So, what are the symptoms? What may be the symptoms? Symptoms: there may be a sore which is not healing, an ulcer which is not healing, difficulty in chewing or swallowing, difficulty in moving the jaw or tongue, swelling of the jaw that causes difficulty, like they cannot open their mouth properly in later cases of oral cancer. Apart from that, there may be loosening of teeth, voice changes, lump or mass in the neck, weight loss, and persistent bad breath. So these may be the symptoms which many people may ignore. Someone may think that, okay, I have an ulcer, what's the big deal? But be cautious. If it is an ulcer and it is not going for last 2 weeks, in spite of having treatment and all, then it may be a symptom. It may be a sign that you are having, that person may have been suffering from some kind of cancer in the oral cavity. So that should not be ignored. Now what should we do? Closing the gap. Self-examination of the oral cavity. That we have to look into our mouth by ourselves. Apna hat Jagannath. So we have to take care that we look into our mouth and we find out if there is some kind of ulcer, there is some kind of lump, there is some kind of color changes, all these things. And then health personnel can also examine the oral cavity. Now this is a leaflet where we have seen that how we can do the mouth examination. That is, we can see the mouth. So when we do the self-examination of the oral cavity, as usual, because you are going to be health professionals, I'm telling this, that in medical terms, we have 3 parts of examinations, right? One is what? Inspection, palpation, and percussion. In case of self-examination, we deny the percussion thing, but we have to do the inspection and palpation. Inspection for any kind of ulcer in the mouth area, any kind of swelling in the mouth area, or any kind of color changes in the oral cavity area. That area I have already shown to you, like the uvula, the anterior pillar, the posterior pillar, right? The hard palate, tongue, the dorsum of the tongue, the ventral side of the tongue, the lateral sides of the tongue. No area should be omitted. So once a month, everyone should do the, what they should do? Johnny, Johnny, yes, Papa. Open your mouth, ha, ha, ha. Okay, so that oral cavity examination is a must. Every day, we don't forget to put our kajal, our lipstick, but we have to open our mouth once in a month to see if our mouth is having any kind of changes. So that is a must. And this message should go to the community. You have to give this message to the community. Now these are some potentially malignant lesions. As I have shown, you can see this is white patch or leukoplakia. This leukoplakia is comparatively less potentially malignant than erythroplakia, that is the red patch. And this is a condition what is called the oral submucosal fibrosis. Oral submucosal fibrosis is a condition where it is very difficult to open the mouth due to fibrosis inside the oral cavity. Usually our mouth is elastic. But when this submucosal fibrosis occurs, our mouth becomes plastic. So this is a condition which is called oral submucosal fibrosis. And growth may be presented in different types of lesions, with different types of lesions. For example, it may be ulcerative. That is, you know what is an ulcer? It may be ulceroproliferative, that some area is going down and some area is coming up, like proliferation is there. And it may be invasive. Invasive is usually the late stages, that it goes inside the body into different structures, right? So these are different presentations of oral cavity cancer. But we should never neglect any lump inside the oral cavity or anywhere. Specifically for oral cavity neck area, we have to examine the neck area as well, because metastasis may occur. So we don't have to neglect any area. Now jumping to the next most common. So till now we have understood what are the common cancers, what is oral cavity cancer, what are the different risk factors of oral cavity cancer, what is called the oral cavity, and how to close the gap. So, what are the signs and symptoms? We have gone through all these topics. Now next, let us discuss a very really bordering kind of cancer, which is often neglected, but it is taking toll on the lives of Indian women. So that is breast cancer. Now, why breast cancer happens? Actually, breast cancer have two types of risk factors. Some risk factors that cannot be changed, and many risk factors that we can change. Now, what are the different risk factors that we cannot change? That is destined, that is in the genes, that is in our fate. So these are not changeable. First of all, I'd like to say, being a female is the major risk factor of breast cancer. Right? Being a female, being born as a female is a blessing. But being a female is a major risk factor of breast cancer as well. Then we cannot change our age. With increased age, we have seen that breast cancer, the chances of breast cancer is more with increased age. Then family and personal history we cannot change. Like we cannot say, God, please let me take birth in this particular family. No, we cannot say. That is destined by someone. I don't know who decides it, like where we will be born. And we never know in that family what gene we carry. So, breast cancer is a cancer that has a very important family connection. In cancer, we have seen only 5% of cancers are genetically transmitted. Only 5%. But in breast cancer is one of those cancers. If a lady comes to us with a family history of breast cancer in her maternal side, say her mother, her aunt, her sister, someone in her maternal side suffered from breast cancer, then we have to become cautious. We have to ask her to do regular screening processes, as well as even we may have to go for the genetic counseling. Right? So we have to find out what gene mutation may be there inside our body. So this thing we cannot change, like our family history. We cannot change our personal history. When we will menarche, when we will have menarche, when we will menopause, that we cannot change. Whatever happen will happen. Then sometimes we are not being able to change our reproductive history. Some people, they are infertile, that is permanently infertile. So that we cannot change even. That is our fate. So that is also a risk factor of breast cancer. If someone is not having baby, if someone is late marriage, everything is this is a breast cancer risk factor. And apart from that, race is also it is destined, like it is decided, pre-decided. So okay, fine, that is our destiny. But can we change our destiny? Yes, we can change our destiny to a great extent by our own lifestyle and behaviors. How? These are changeable. We don't want to become obese because obesity is directly proportional to all type of cancer and specifically breast cancer. So exercise is a must. We can do regular exercise to get rid of this problem. We have to breastfeed our baby because breastfeeding have a kind of protective effect on the breasts of the mother. So breastfeeding should be promoted. Then alcohol should be avoided. Then hormonal replacement therapy. Here we can see that whenever we play with nature, then something very dangerous happens to the body. In India, hormone replacement therapy is not that common, but in some countries outside India, we can see that they are. It's very common for them to use the hormonal therapy like estrogen supplement and all to remain young. So this may disturb the body hormone levels, and ultimately it may disturb the breasts and it may cause breast cancer. Then birth control pills for a long time without any monitoring or supervision of a specialist. Then not having children by choice, of course. The previous one, that is not changeable, that was not by our choice, by destiny. But if someone is not having children by choice, no, nature won't tolerate. So better we don't play with nature, and our body will definitely help us to stay healthy. Now, what are the symptoms and signs of breast cancer? Actually, from our own experience also, most common presentation of breast cancer is a painless lump. Most common presentation. Sometimes there may be pain if the lump is there over a nerve. So there may be pain as well, but mostly they come with a painless lump. And by chance they detect it. By chance, during bedding and all, sometimes they get a feel of some knot, and then they become a little bit cautious, and then they come, but it is already late. Then there may be skin changes like puckering, dimpling, and color changes. That may be redness. Now, skin changes, we have a specific name for that. That is pseudo-orange appearance. That is the orange peel appearance. Have you seen nowadays, abhi to mausam hai na, kamolar din. So have you seen the peel of orange? This is some different kind of appearances there, no? All dots, dots, dots. So if someone is having some kind of molecular changes or metastatic changes or some kind of, changes inside the breast which is malignant, then this skin changes may occur, which may appear like a orange peel. Okay, fine. So there may be changes in the nipple also, nipple area. There may be change in nipple direction. There may be scaling around the nipples, retraction that is going inside, and there may be nipple discharge. But here, I'd like to mention, all the lumps are not cancer. All the nipple discharges are not cancer. If you get a bloody discharge, that is definitely, it is alarming. But many people, they have some kind of discharge, nipple discharge, which is due to duct ectasia and all. But whatever, if someone sees that there is nipple discharge or there is some kind of retraction, then she should consult a physician or a nurse. Now, symptoms and size, we can also see that there is change in breast size. There may be pain and tenderness, or there may be sore. That doesn't heal. Cancer doesn't heal like that. So how to close the gap now? Number one, breast self-examination is the most important thing. That gap can be closed by the community itself, or the person by herself or himself. Here, breast self-examination is advisable in male as well as in females. Both female and male should do the breast self-examination. There may be clinical examination by MD nurse or a nurse, and there may be mammography. These are some screening tools, that is methods of detection. Apart from that, some other methods of detection like FNAC, that is fine needle aspiration biopsy, where small amount is drawn from the tumor and we see just under the microscope. Then there may be biopsy. Some more tissue is taken out and seen under the microscope. Now when to do BSc? BSc, should I detail about BSc, or should I later on give you the IC materials? Later we can do. So here I should not explain the BSc, ma'am. Should I? Or later? Okay. With you the IC materials so that you can go through those IC materials and know how to do the breast self-examination. So these are some IC materials we have. I request Bhavani kindly to coordinate and send the ICs to Royal Global. So this is a case of male cancer, male breast cancer. These are some late presentations we had. Now, cervical cancer. Cervical cancer, we all know what is cervix, and we all know that the causes and risk factors which is identified is HPV. human papilloma virus. Now, do you think that HPV infection means cervical cancer? How many think that HPV infection will lead to cervical cancer? How many think that cervical cancer can be caused? It will surely cause cervical cancer, HPV. How many of you do not think? A. They don't think, they do think. What is this? No response? Are you sleeping? Most probably we had your lunch, no? Right? Now you are feeling tired and sleepy, no? But do you think that HPV infection will lead to cervical cancer? Tell me. Even I am sleepy. Okay, so this is identified causative agent of cervical cancer. Now, does HPV infection always cause CA cervix? Not necessarily. Because our human body, we have a power. We have one special power that is called immunity. And this immunity, in case of cancer also, immunity counts, right? So, 75% of sexually active women have been exposed to HPV by 18 to 22 years of age. But only few of them develop in later stages to cervical cancer. Now, most of these HPV goes away. They are cleared off by the human body. They're cleared off, they're kicked out of the body. But few HPV, they are too cunning to go inside the cells of the cervix so that they can go inside the cell and replicate to create their own DNA inside the cells. So ultimately, these cells become the angry cells, which may in later stages become dysplastic and ultimately carcinogenic cells, cancer cells. So only few % of cancer cases are occurring due to HPV infection. Now, who is at risk? Early marriage. Interesting. In breast cancer, late marriage. In cervical cancer, early marriage. That means don't play with the nature. Whatever is natural is natural. There is a specific time of getting married. If you are late in your marriage, then you are at risk. If you are doing early marriage, then you are at risk. If you are having too many children, you are at risk. If you are having no child, you are at risk. So ultimately, God has created some rules. We have to have that, we have to have that faith that God has created some rules that this is the rule. If you break, then you go to, your cells become, they won't tolerate or they don't follow the law of the nature. You don't follow, your cells don't follow. So early marriage, young age at first pregnancy, okay? In case of breast cancer, we have seen late age at first pregnancy. In cervical cancer, young age at first pregnancy. Short interval between pregnancies. Previously, no pregnancy. Then poor nutrition, of course, it is equal in breast and cervix both. Poor hygiene, that is very important in cervical cancer. We have to make the people aware about how to maintain the menstrual hygiene and sexual hygiene. How to change the pads within 6 hours. Not to use the pad more than 3 to 4 hours, right? So these things we have to educate the females, young children, how to use it, how to do it, and also the sexual hygiene. Now, women with STD, those people who are having sexually transmitted diseases are usually having multiple partners, and that is a major risk factor of HPV infection. And HPV infection is directly proportional to cervical cancer. Though all the female may not develop to cervical cancer, but some of them may turn into cervical cancer. So, women with STD. women with multiple sexual partners or husband with multiple sexual partners, because from husband also sometimes this innocent lady gets infected. So again, nature, be loyal. That is also important, very important. So smoking. Smoking is also a cause of or risk factor of cervical cancer. So what are the different types of symptoms? Symptoms, cervical cancer, unfortunately, it is asymptomatic in early stages. This is very unfortunate. If someone is having pain, then he will run to the doctor. If someone is having a tooth problem, within 2 days he has to go to a doctor, right? Hanti nai, you have to go, right? But in case of cancer, it occurs very silently. That is why it's a killer. That's why it's a killer. And in later stages, there may be bleeding, which is postcoital, not later stages, but like these are the symptoms. Someone may present like with postcoital bleeding or intermenstrual bleeding, which many people take it as okay, fine, it happens. Then postmenopausal, this is very dangerous. Some lady, she had menopause, she completed her 1 year of menopause, 1 year. I'm not saying that within 6 months, I'm saying 1 year. Then after that, she is again having bleeding. So that may be an alarming sign or symptom of cervical cancer. There may be vaginal discharge, which is often neglected. White discharge, purulent discharge, or red discharge, watery discharge, whatever discharge. So we have to become a little bit cautious. And pain in later stages, and rectal and urinary stages, along with backache in very late stages. So these are different types of symptomatology a person may come to us. Then how to do the early diagnosis? Number 1 is, as usual, awareness. We have to make the people aware. I'm not saying that we should become aware, because already you are nursing students or whoever is in this auditorium all are related to health. So except one, of course. So that is my son. All the time he is shouting and running here and there. So accepting all of you are medical personnels. So all of us, we have to make other people aware about these symptoms, early symptoms of cervical cancer, and need of getting screened. That is very important. How to get screened so that we save our life. Okay. So screening, how it is done? Screening is done by very easy examinations, like VIA, that is visual inspection with acetic acid, VILI, that is visual inspection with leukocidin, and PEP, that is Papa-Nicolau staining, right? Now what is VIA? VIA ki bostu. What is VIA? VIA is nothing but acetic acid. You all know vinegar type of solution. It is diluted. Okay, 5% or something like that. And with that, we just paint the cervix, because cervix is very easily accessible. In this short session, it is not possible to show you the ways of doing VIA and VILI, but I hope that in near future, we can train, if you want, how to do VIA and VILI by some physical sessions with patients practically. Right? So, in Royal Global, is it given, this kind of training is given how to conduct early screening processes? Is it in the curriculum? Cancer screening? That becomes too specific, I think, no? So this kind of investigation is very easy to conduct. Like you have to just put one speculum, right? And you have to retain the speculum and just see through the cervix. You can see the cervix very easily and paint the cervix with a small brush is there, or with your swab you can paint with the acetic acid, and after that you look at the cervix. The areas which take the aceto-white stain, that is, if it becomes white, then these areas must have some kind of pathology. We wait for 5 to 10 minutes and then we check. Then VILI is also same, because there is a different color, there are color changes, and PEP is nothing but with the PEP brush, we take some of the tissue, some of the cells, and just look under the microscope. Very easy procedure. It is not painful. It is not invasive. And the lady sometimes, after doing the test, she asks us, "By the whole goal niki? By the whole goal niki? Ma'am, is it done?" So that much painless and easy procedure these are. So this is how we take a pap smear. You can see this is the cervix and this is the brush. We introduce the brush and just rotate it little bit, and we take it out and we spread over a slide and we do it. These are only the two instruments these are needed for doing the pap test, along with the pap test, yes, along with the slide, of course. Then these are some screening recommendations for cervical cancer. These are below 21 years, actually no screening is required. 21 to 29 years, cytology will do. That is, pap test will do. But 30 to 65 years, co-testing HPV and cytology. HPV is a very upcoming type of, investigation by which we can understand the level of infection. If there is HPV infection, if the person is at risk. And now too, we are conducting a GACD, that is Global Alliance for Tobacco Non-Communicable Disease. That platform, we are doing a self-sampling of HPV DNA in particular 6 villages of North Guwahati. So that will definitely bring us some knowledge about what kind of HPV infections are ongoing in the community and how people respond to this self-sampling. Because going to a doctor and just opening oneself to a doctor is difficult, but doing self-sampling, maybe the community may accept it better. So at the end of this project or work, research work, we'll be able to know better how this works. So HPV is also a kind of screening, HPV screening. Then above 65 years, usually we don't advise any kind of screening process. And after hysterectomy, we don't do any screening. So HPV testing is another thing that I have already said. And HPV vaccination is, I think recently they have announced HPV vaccination in immunization program. So this is a very important step by the government of India, because previously due to cost factors, this was not done. But now probably they are going to cover it. Now vaccines are now, it will become available now. Bivalent and quadrivalent vaccines are available, and they are divided into different, 0, 1 and 6 and 16, 18, 6 and 11 months. So 11, these are the types of vaccines given in different doses, different shots. And 0, 2 and 6 months. Usually 3 doses are given, and before the lady gets exposed to any sexual exposure, this is better, we give it. Because after exposure, anyhow, she is getting exposed to HPV, because HPV is very common virus. As I have said that 75% women are already exposed to HPV by their 22 years. So usually it's up to 26 years it is permitted. Now let us go through these 9 cancer danger signals. I think the nursing wing of Global University, we must have a hoarding or a table or a standee mentioning these 9 signals, danger signals of cancer. So I'll try to send you few IEC materials with these 9 cancer danger signals so that you can use it in some areas. Now, what are these 9 cancer danger signals? We remember it as caution us. C stands for changes in bladder and bowel habits. Then A for any sore throat which is not healing. U for unusual bleeding or discharge. T for thickening or lump in breast or anywhere. I for indigestion and difficulty in swallowing. O for obvious changes in water mole. O for obvious changes in water mole. This is, beauty spots. Many people, we have beauty spots, but beauty spots are also dangerous because if it changes its color, size, it becomes itchy, then malignant melanoma can be suspected. And apart from that nagging cough or hoarseness of voice, we get many people with hoarseness of voice and cough and ultimately diagnosed with laryngeal cancer. Even esophageal cancer, in case of esophageal cancer, we get some kind of involvement of the larynx later on. So these are some symptoms. And newly added unexplained anemia or fever and sudden unexplained weight loss. So these 9 cancer dangerous sickness by American Society, it's very important to remember. And in community, usually people don't know what happens in cancer. Basically, our motto is to close the gaps, because we may know, but the community may not know. So we have to spread the message. That's how we can close the difficulty or close the gap in cancer care. So these are some very important this thing. So again, these are some pictures. This is just memories, few memories, different organizations and all these things. Now I'd like to request all of you kindly to note down this number. Kindly to note down this number so that you can help others. This is a very important number. This is a helpline number. We all know that tobacco is a major risk factor of cancer, and most of the cancers are tobacco related. And we have seen that many of the people are using tobacco. Most of the people are using tobacco, rather we say. So how to close this gap? How to help the people? This is a National Tobacco Quit Line number. We are fortunate to have one at Dr. B. Borua Cancer Institute. This is by Ministry of Health and Family Welfare. Only 4 of these kinds are there all over India. One is at TMC, Tata. One is at Nimhans. One is at Vallabhbhai Patel Chest Institute. And fortunately, Government of India selected our institution under preventive oncology. We are having this regional, now national, upgraded to National Tobacco Quit Line. And I'm happy to inform you that till now we have helped around 25,000 people to quit the habit. This is a toll-free number. Anyone can call for help between 8 a.m. to 8 p.m. from Tuesday to Sunday. This is fortunate for us. We are fortunate that even Sunday we have them, and this is very unfortunate for them that they have to work on Sundays. 10 counselors from 8 a.m. to 8 p.m. they sit and they do the counseling for 12 hours a day. We're trying to make it 24/7, but because of human errors, it is not till now possible. But this is a toll-free number, and definitely is going to help the mass. So, actually, these things are these things happen in our life. When we can stop, we are really not bothered to stop it. But when we want to stop it, we cannot stop it. So prevention is always better than cure. So with these words, I'd like to conclude my session for today. Thank you very much. Thank you once again for inviting me to this wonderful university and wonderful department. Thank you very much.